Addiction specialists are on alert for a new street drug that's so dangerous the White House issued a warning about it just this week. It's called Tranq, or Tranq dope, a combination of fentanyl or heroin and the animal tranquilizer xylazine. Now, xylazine is a strong anesthetic used in veterinary medicine that, when mixed with other opioids, can cause profound sedation and central nervous system depression. Users can die because they're so out of it they can't even breathe on their own. It causes a zombie-like state and severe skin ulcers that could result in amputation. There's no fast test available to check for xylazine overdoses either, and Narcan doesn't work. So as law enforcement watches the streets closely, doctors are preparing for another wave of a dangerous drug combination in the fight against opioid use disorder. I spoke with an addiction medicine specialist about why this is a dangerous moment in this street drugs evolution.
I mean, do they know when they're doing these drugs that xylazine is in there and that's desirable to them, or are they getting it not understanding really what's in the drug they just bought?
I think in this initial wave of xylazine associated deaths that we're seeing, people are not aware that it's there. So they're not necessarily seeking it out. In places where xylazine has been in the community for a while, for instance, on the East Coast in particular, there might be specific drug-seeking behaviors for this contaminant, or this component of fentanyl and heroin. But I think that the greatest concern right now is that people are consuming it with zero appreciation for the fact that it's there.
Dr. Jason Schmidt is a primary care doctor and an addiction medicine specialist at Community Medical Services. They have outpatient treatment programs at 4 locations across Montana. The FDA is adding new safety warnings to opioid pain meds. All opioid drugs will now include a warning about increased sensitivity to pain and the risk of an overdose. The FDA says patients who use opioid pain relievers after surgery often have some left over, and that puts them at risk for overdose or addiction. Regulators say the updated safety warnings will give clarity about who should be prescribed these drugs, as well as the appropriate dosage and administration.